I'm going to go ahead and draw the subscapularis tendon, which is inserting here on the lesser tubercle. And so the area that I'm going to look for is, again, that I showed before, was locating the lesser tubercle by internally and externally rotating the humerus, and then I can feel for this edge. And the lesser tubercle, I'm sorry, the subscapularis is going to insert along this bone here, along the lesser tubercle there. So there's my insertion point for the subscapularis tendon. The next tendon that I can look for is the biceps, the long head of the biceps, which sits in the bicipital groove. And what I can do is get let the arms rest on the side, and I get a nice isometric contraction of into scaption, so then push out against me. And usually where I'll find the tendon of the biceps is right here in this indentation between layers of the deltoid muscle. And so if I can feel that area here, this is where I can palpate the tubercle where the biceps tendon sits. And so I can confirm this by externally rotating. I can feel the lesser tubercle push into the medial aspect of my finger, and when I internally rotate, the greater tubercle will press into the lateral aspect of my finger. So I can feel in this spot here for that space. And so this is where my biceps tendon is going to run. And so I'm going to draw that in. So here is the biceps tendon going up through the bicipital groove. The next soft tissue structure that I'm going to find is a really important one, and I'm going to have him turn and face this way and look for the supraspinatus tendon. And so go ahead and scoot back for me. And so what I want to do, scoot forward, scoot your butt forward, and then lean back. And so I want to get him in this position, and then the arm position behind his back. So scoot over just a little bit if you can. And I want to be able to, I don't want to have the arm in a flex position. I want to let it extend and come back. And so what this does, this brings the supraspinatus tendon out from underneath the acromion. So here's my acromion here, and here is the superior surface of the greater tubercle. And so what I can look for is a box, basically. And so I can find the anterior edge of the greater tubercle. So if I keep pressing down, eventually I'm going to fall off of the greater tubercle. I'm going to kind of outline that anterior border of the tubercle here. So that would be the anterior most aspect of the greater tubercle. I'm going to outline the lateral most aspect of the greater tubercle here. And then the medial border is going to come right here. So if I go press down and keep going medially, eventually I'm going to fall into, this is where the bicipital groove is at in this position. And so here is a nice outline of the superior aspect of the greater tubercle. And the area that I'm going to palpate for the supraspinatus tendon is going to be right here in this medial anterior portion of the box, right here. Okay, and so that's where I'll palpate for the supraspinatus tendon, right here on the top of the greater tubercle. The supraspinatus will come in, here's the spine of the scapula, it will come in and insert in this area, and there's the orientation of those fibers from the supraspinatus, inserting here in this medial and anterior section of the greater tubercle. The final tendon that I'm going to look at is the infraspinatus tendon. We're going to have him sit up, and for this one I need to get him lean forward. In some cases I'll get the patient positioned in prone, but if I can get the shoulder flex to about 70 degrees, so go ahead and bring your arm down, 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 down. So that gives me about 70 degrees, and then I'm going to externally rotate this way, and in order to get some adduction, I'm going to have him lean this way. So this brings out the greater tubercle in a way that I can palpate the infraspinatus. And so what I can look for is the posterior corner of the acromion. Now it's a little bit, it's changed from the original position where I marked it at before. Now it's about right here. And I can drop a nice little helper's line down towards the axilla. And so that's going to give me a great spot to start palpating, because this is going to be where Here's the border of the spine of the scapula here, and my infraspinatus tendon is going to come in and insert right on, here is the lateral edge of the greater tubercle, right here. So I can get a nice little outline. And so the fibers of the infraspinatus tendon are going to run this way. They're going to course laterally and insert here on the greater tuberosity. So right here. So the myotendinous junction is going to be somewhere in this area, and the insertion point is going to be here along the greater tubercle. So again, the position that I want to get him in is 70 degrees of shoulder flexion, external rotation, and then adduction, and get him to lean this way. And so that makes the greater tubercle nice and prominent, and I can palpate along this area and feel for the tendon of the infraspinatus.